Important news for women going through menopause. There's new evidence that taking hormone replacement therapy increases the risk of breast cancer and also increases the risk of dying from it. Last year alone, 40 million prescriptions for hormones were filled in the United States. And joining us now is our own Dr. Jennifer Ashton, a board-certified OBGYN who discusses hormone treatment with patients every single day. And there are a lot of women out there who say, I'm menopausal, I have got to have this, I can't live without it.
Right.
And so that's what accounts for these phenomenal number of prescriptions.
Yeah,
right?
This is a huge number of women, Harry, and it's important to remember that menopause, 15 to 20% of women going through menopause will have no symptoms. 10 to 15% of women will have severe symptoms,
Right.
and they will tell you it is disabling. They cannot go
Right.
on with their day-to-day life without some kind of treatment.
And has the conventional wisdom sort of been, okay, so hormone therapy, if we limit it, is okay?
Well, yeah, that's the premise in all
Right.
of medicine. You want to give the lowest dose of any medication that works for the shortest period of time.
Right.
But what's striking about this study is that we've known since 2002 that
Right.
hormone replacement therapy increases the risk of breast cancer.
Right.
Now, for the first time, we know how much. We know that it increases the risk not only of invasive breast cancer, but of finding more aggressive breast cancers and, as you said, of dying from breast cancer. So again, this is potentially really going to change the landscape
Right.
for that woman as she talks about her risks with her doctor.
Because this is, we had this news in 2002. This then just sort of adds fuel to the fire of why it's not such a good idea. At the same time, though, people will look at these numbers and say, okay, statistically, I see the chance is greater, but overall, the statistics are tiny numbers per, say, 10,000.
Correct, and that, you brought up a key point, Harry. The absolute risk, what this study found, is that it results in 1 extra death a year from breast cancer per every 10,000 women. So again, you might look at that and say that risk is acceptable to you.
Right.
But when you talk about breast cancer, that gets all the attention. What you usually don't hear when you talk about hormone replacement therapy is that the same study found that women who take HRT also reduce their risk of colon cancer, reduce their risk of fractures from osteoporosis, and certainly it does relieve symptoms. So it has to be balanced.
Right, so as you read this in the paper, as you go to WebMD or read through this stuff today, as you go back to see your doctor, this is a conversation you've got to have.
It's an ongoing and very complicated conversation that has to go on between a woman and her doctor.
Dr. Jennifer Ashton, thank you so much.